I wouldn't say I was in denial about it, but I questioned the severity of the problem. You know, I think a lot of people do. Somewhere in mid-June, I had a relative that got it. I'd spent some time with him on one particular day. My first symptoms were a bad headache a few days later, and then allergy type symptoms, stuffed up, sneezing, things like that. And a few days later, I lost taste altogether, completely. Like Listerine tasted like water. It was very strange. I continued to work every hour I could and was, just physically and mentally exhausted. I had read the CDC guidelines, and the rule was you were supposed to quarantine yourself for 10 days after your first symptom, which ended up being the 3rd of July, which was when all of the family and friends were getting together. And at that point, I wasn't sick. All I had was 1 or 2 or 3 symptoms, and those went clear back to that 10 days. So the 3rd of July, I go down to West Yellowstone with the family, and we have a big get-together. My brothers and I all go out the 3rd of July and celebrate the 4th like we do annually. The next day I woke up and I was very tired on the 4th. The 5th, I was very tired, and at that point started to wonder if something wasn't manifesting itself within my body. Was I still truly hungover, or were these symptoms of COVID? And from that point forward, I got sicker and sicker. I really couldn't breathe very well. I could breathe on short breaths, but I had a difficult time even rolling over because my lungs were affected in a way that being on my side basically couldn't breathe. My daughter freaked out when she saw me and said, "You have to get to the hospital," and started crying. And I said, "Listen, if you just let me lay here, I'm gonna be fine." My buddy told me to get in the car, we're going to the hospital. And, out of respect for these two, I did.
I first met Shiloh the day that he arrived in our emergency department. At that time, he was quite ill with severe COVID-19. We suspected, and then later that evening confirmed. He was on pretty much the maximum amount of oxygen that we can deliver without intubation and mechanical ventilation. We gave him 3 treatments that we did not have available to us 3 months ago: convalescent plasma, remdesivir, and Decadron.
From my perspective, I don't know if this is true, I feel like from that point forward, I did continue to improve. The isolation in the ICU was, very difficult.
He described himself as going stir crazy by just being in a room with nurses in personal protective gear that doesn't allow him to see anyone's face.
A lot of time to think, a lot of time to consider the realities and the perspectives on your life. I believed I was getting better, but I don't know that everybody else was convinced of that, and I knew that. They didn't give me good statistics or odds of making it through it because of the limited experience they did have. It hadn't gone well. finally, at some point in this 5 days, I told a nurse, I said, this has gone from a COVID case to a mental health case. I just was hungry for freedom out of this situation. Between truly seeing that maybe I'd improved to the point, but also seeing how desperate I was to get out of that environment, they worked on coming up with another solution and got me to a room with a window over the bridgers and some greenery, and I felt like I had died and gone to heaven. I was so relieved to be out of there. I mean, I've never felt as euphoric as I did the first several days of being released from the hospital because of the experience of going through it. I was on the mend, I was now in fresh air, and I've never been that happy. It makes you put things in perspective in terms of just the help you get, the friends you have, the family you have, the people that care about you, the doctors, Dr. Bethel, the nurses, the facility. It felt like I was, given another life. Once I was home, and you have the tranquility of being home and the peacefulness of it, you start to think, what did I just go through? And as I put the pieces of the puzzle together, the further away I went from it, the more afraid I became of the situation that I had just come out of. And to think that I could have put other people in that condition by my actions really made me afraid for what, of the predicament I had been in and possibly could have put other people through, and how lucky I was to come out of it alive. And the part that didn't sink in right away, but kind of went through as the weeks went on, was that I didn't kill anybody else, which is a scary thought because it could have. It's a sobering thought to think that your actions with catching this virus will have an impact on other people's lives.